Hello, everyone. Thank you for joining me today. I'm here to talk about primary progressive aphasia, also known as PPA. This is a complex and often misunderstood neurodegenerative condition that primarily affects language abilities. So what is primary progressive aphasia? Primary progressive aphasia is a neurodegenerative condition that impacts our ability to speak, comprehend, read, and write. To visualize this, imagine a library filled with books on every shelf. This represents our language abilities. Over time, those books start to go missing or become worn out, illustrating how communication skills can decline gradually in PPA. The disease begins in the language centers of the brain, particularly in the frontal and temporal lobes. As it progresses, it spreads to other areas. This can lead to cognitive symptoms like memory loss, deficits in executive functioning, or even changes in personality. Differential diagnosis of PPA can be quite challenging due to the overlapping characteristics of its variants. This is critical because classifying the type of PPA can guide treatment recommendations and help anticipate future needs for patients and their families. So, what does primary progressive aphasia look like in daily life? Here are some common communication changes that may occur early in the disease. Speaking may require significant effort. This is like effortful speaking. Conversations can feel slower than usual. Individuals might struggle to find words or mix up the order of words. They may use the wrong word altogether, saying table instead of chair. Understanding words and following conversations become increasingly difficult. They might also make spelling errors that are atypical to them or outside of the norm. These symptoms can profoundly affect social interaction and the overall quality of life. Statistically speaking, fewer than 200,000 people in the US are affected by primary progressive aphasia, which equates to approximately 1 out of every 100,000 individuals. Understanding and raising awareness about PPA is essential for advancing research and improving clinical practices. Advancing our knowledge of PPA not only deepens our understanding of neurodegenerative diseases, but also enhances patient care. A multidisciplinary approach, like addressing cognitive, communicative, and emotional health, is vital. Language is fundamental to daily functioning and social interaction, and addressing PPA challenges can significantly improve a patient's quality of life. Speech-language pathologists play a crucial role by helping patients develop coping strategies that enhance social participation and the emotional well-being. Now let's dive into the three main types of primary progressive aphasia. The first one is going to be non-fluent or agrammatic, and that one is going to look like poor grammar in written and spoken language, trouble understanding complex sentences, using grammar incorrectly. This individual may have problems speaking, which includes making errors in speech sounds, also known as apraxia of speech. The second one is going to be the semantic variant. This is going to look like trouble understanding spoken or written language, particularly single words, trouble understanding the meaning of words, the inability to name objects, and difficulty formulating sentences. And lastly, the third one is going to be the logopenic variant. This is going to be trouble understanding spoken language, particularly long sentences, pausing and hesitancy during speech while searching for words, and the inability to repeat phrases or sentences. Regardless of the variant, as PPA progresses, individuals will eventually lose the ability to speak and write, with potential impacts on memory, planning, and daily living skills. In some cases, motor issues may arise, requiring assistance with their day-to-day care. So to wrap this up, primary progressive aphasia is a multifaceted condition that profoundly affects language and cognitive functions. Understanding its symptoms and variants is crucial for developing effective treatment plans. I hope this helps shed some light on the importance of recognizing and addressing PPA.
Thank you for that insightful overview of primary progressive aphasia. Now let's shift our focus to another important aspect of communication disorders, aphasia itself. Aphasia is an acquired communication disorder caused by brain damage that affects a person's ability to understand, produce, or use language. It disrupts the ability to generate and use various symbol systems, whether they be written, spoken, or gestural. There are several different types of aphasia, each with unique characteristics and underlying causes. Let's take a closer look at these. Broca's aphasia. This type is primarily caused by a stroke in the Broca's area, typically due to a blood clot in the middle cerebral or internal carotid artery. Other potential causes include traumatic brain injury, tumors, brain infections, and Alzheimer's disease. Wernicke's aphasia. This main cause here is an ischemic stroke affecting the posterior temporal lobe of the dominant hemisphere. Additional causes may include brain tumors, trauma, central nervous system infections, and degenerative disorders like Alzheimer's. Conduction aphasia. This type results from a small stroke in the posterior temporal branch of the left middle cerebral artery. Other causes can include strokes, head injuries, and infections. Pneumic aphasia is the primary cause, is typically a stroke, but it can also arise from brain tumors, brain infections, severe head injuries, and progressive neurological disorders. Transcortical motor aphasia. This can result from a stroke or brain injury, as well as severe head trauma, tumors, or gunshot wounds. Transcortical sensory aphasia. This type is caused by lesions in the temporal lobe, especially near Wernicke's area. Other causes include head injuries, tumors, and degenerative disorders. Global aphasia. This is often due to significant brain damage from a stroke. Other potential causes include gunshot wounds, brain tumors, infections, or progressive neurological disorders. Mixed non-fluent aphasia. This is primarily caused by the left hemisphere watershed stroke and can also result from gunshot wounds, infections, and tumors. Now that we've covered the types of aphasia, it's important to clarify the differences between primary progressive aphasia and other forms of aphasia. PPA, which is also known as primary progressive aphasia, PPA is distinct from aphasia resulting from stroke or brain injury because it is a progressive disorder. This means that communication challenges in PPA start gradually and worsen over time. Additionally, while both PPA and Alzheimer's disease fall under the umbrella of dementia, they are also not the same. PPA primarily affects language and communication skills, while Alzheimer's is more associated with memory changes. In summary, understanding the various types of aphasia, their causes, and how they differ from primary progressive aphasia is crucial for accurate diagnosis and effective treatment. By raising awareness about these communication disorders, we can better support individuals affected by them.
I used to do presentations and talk to the staff. At times, that's all gone now.
Primary progressive aphasia is the term we use to refer to a set of dementias that affect a person's ability to use language. Progressive non-fluent aphasia, which is also known as the non-fluent agrammatic variant of PPA, is a disorder of expressive communication. So it either affects a person's ability to produce speech or it affects their ability to use grammar appropriately. And it can affect people in terms of how they speak and also in terms of how they write as well.
It affects the telephone most, and I used to wave my hands about in facial expressions. I can't do anything like that on the phone.
The person might notice that their speech is becoming more effortful, it's becoming harder for them to produce words. They might notice this particularly in high pressure situations.
Having previously done speeches and presentations, Bill struggled to start with. It was very frustrating for him.
Progressive non-fluent aphasia it falls within the wider group of dementias known as the frontotemporal dementias. So we know that the same proteins that are involved in frontotemporal dementia are involved in progressive non-fluent aphasia.
Bill has been a member of the Rare Dementia Support Group for about 2 years now. The group have supported Bill extremely well in various areas because you've got like-minded people and everybody shares their experiences, and they've had speakers that have been particularly good in various areas.
I've got a dietitian who keeps me fit. I go to speech therapy and they come up with strategic things that I can do on the telephone and how to run my life.
As he's become more confident, it's just a case of being a little more patient.
They understand how I am doing. I get the message across.
I'm not fascinated by how the brain deteriorates, fascinated by what my husband is able to still do with the experience we provide him. And I think we've done quite a lot on that front.
Semantic dementia is one of the major variants of primary progressive aphasia. It is a disorder that affects a person's semantic memory system, and semantic memory is our system for knowledge that we build up through our lifetime. So our knowledge of what words mean, our knowledge of who people are, our knowledge of what things are, that system slowly is becoming worse and worse.
My husband has got semantic dementia. It's language that's really affected. So he has struggled communicating what he wants.
The person initially might have problems understanding the meaning of words. So if you said to somebody, please can you pass me the scissors, they might reply, what are scissors? And as it goes on, they might not even be able to recognise what scissors are. If you put them in front of them, they might not know how to use them.
It's had a very significant impact on his life. The prefrontal cortex, is all about the executive function, judgment, personality, making decisions, even small ones. He struggles with them. And because it's regressive, we're going through a change on a constant basis.
The proteins that are sort of causing damage to the cells in the brain are the same proteins that we see going wrong in a wider group of dementias known as the frontotemporal dementias, and that's why semantic dementia can also be categorised as a type of frontotemporal dementia.
When this happened, we just didn't know how to deal with it. And it was also confusing what that meant. If it was a physical illness, you kind of know what it means. But because it's brain, you don't know what exactly he can do and can't do. So that in itself was a struggle. But with encouragement and love and somebody behind him, he can live a very good life.
Primary progressive aphasia is the term we use to refer to a set of dementias that affect a person's ability to use language. Logopenic progressive aphasia is a type of PPA, and it's sort of the most recently put on record for 3 major variants. So people with logopenic variant PPA have difficulties with word finding. People can also sort of make small mispronunciations or almost get parts of words a bit jumbled up. So instead of saying animal, they might say aminal and just mix up certain small parts of the word.
I can't write or anything like that. I try all the time, and I take it out and I look at it and I think, yeah, I could try it. And when I do, I can't put the things, it doesn't come out very well.
Well, she's pretty good at speaking. Most people, when you meet her, wouldn't necessarily see a big difference, but actually it's very profoundly affected her ability to communicate. Charmin's first reaction was to step back from social interaction because she knew she had a language problem, and she was ashamed, worried, afraid about it.
So the person will often be speaking normally and then sort of struggle to find the word that they want to say, and it feels like it's on the tip of their tongue. So it's something that we can all sort of understand, and we know what that experience is like. For the person with logopenic aphasia, it's like that a lot, and it's really frustrating and difficult.
Things start to go wrong in the brain, basically in the language area, but they affect some other things. So like something called executive function, which is where you do planning, thinking ahead. That can be affected. And I think in Sharma's case, that's something that she finds difficult.
In logopenic aphasia, it's a problem with the same proteins that we see going wrong in typical Alzheimer's disease. And so for that reason, sometimes people refer to this variant as the language-led variant of Alzheimer's disease.
One of the strategies we've had is trying to find out things. We found that helps us cope, and you can find those out from RDS. Another strategy I think we've undertaken is we did a lot of speech therapy. It's a speech-related dementia, and quite early on we thought, because of Sharma's background in dyslexia, we understood that speech training can be helpful. And finding a good speech therapist meant that she was able to begin to re-engage and understand a bit more about how she could cope.
Okay, so some causes and risk factors. So primary progressive aphasia is caused by shrinking of the lobes in the brain, also known as atrophy. This shrinking mainly occurs on the left side of the brain in the regions that are responsible for speech. So a rare gene changes have been linked to primary progressive aphasia. If members of your family have had it, you might be more likely to develop it. PPA is more likely to occur in people in their 40s and 60s, and people who had a childhood learning disability, such as dyslexia, can potentially be at a higher risk of primary progressive aphasia. Diagnosis. So there can be a neurological exam, so healthcare providers may conduct a neurological exam and a speech-language evaluation and a neuropsychological evaluation. Tests provided will measure your speech, language, comprehension, recognition, naming of objects, recall, and other factors. There's a blood test. A healthcare provider might order a blood test to check for infections or other medical conditions. Genetic testing can determine likelihood of genetic changes associated with primary progressive aphasia. Role of imaging. A brain MRI can help diagnose primary progressive aphasia. The imaging can detect shrinking of specific areas in the brain and can also detect strokes, tumors, or other conditions that affect brain function. A PET scan shows brain scan function, which can uncover problems with glucose metabolism in the areas of the brain that are related to language. Primary progressive aphasia can't be cured, and there are no medications to treat it. However, some therapies might help improve or maintain the ability to communicate and manage the condition to promote the individual's quality of life. Interventions must be tailored for each individual. So how can SLPs help? Speech-language pathologists help by introducing communication strategies and tools. SLPs help by explaining the communication changes that a person with PPA is experiencing and helping to find strategies that support the individual in their participation in the things they want, ensuring their needs are met and that they are able to still do the things that they love to do. Speech-language pathologists also empower the person to advocate for themselves and the communication needs they require everywhere they go, and help establish a community to connect the person with resources to be successful. Supportive care. So it is important for loved ones to continue to include the person in conversations and decision-making. This could look like validating frustrations and using supports like writing or drawing to make the interaction more successful. Communication breakdowns are hard for people in the early stages of PPA. Slow down when you are speaking with someone who has PPA. Use direct language and keep sentences short, sweet, and to the point. Give the person time to communicate instead of finishing the sentence for them, which as a friend or a loved one, it can be hard. Add nonverbal cues to your speech, such as pointing to an object while asking a question about it. If a person's understanding is affected, avoid open-ended questions and provide choices to pick from, and break down the directions into small steps that are easier to digest. research and future directions. So there is no cure for PPA, but both pharmacological and non-pharmacological interventions may be considered to promote quality of life. Pharmacological interventions could also include prescribed medications to help with symptoms of anxiety and depression. Non-pharmacological interventions would look like social workers considering the psychosocial factors that are impacting the person and their family. They may provide disease education, counseling, care, partner training, and support in connection with local resources. Additional therapies are support groups, intergenerational therapy, which is a form of psychotherapy that focuses on examining and addressing issues within a family system that have been passed down through generations. Art therapy, music therapy, pet therapy, and others depending on personal interest. Case studies and real life examples. So, actor Bruce Willis was diagnosed with primary progressive aphasia in 2022. The family has given updates on his progress and condition, emphasizing the challenges he faces with communication and the impact on his daily life, making a point to also recognize his strengths and resilience, expressing gratitude for support and bringing awareness about PPA. Conclusion and call to action. So, in conclusion, primary progressive aphasia represents a complex neurodegenerative disorder that profoundly affects communication and quality of life. Understanding the various types and symptoms of PPA, as well as the underlying causes and risk factors, is crucial for effective diagnosis and treatment. Through collaborative efforts in clinical practice, including the vital role of an SLP, we can enhance patient support and advocacy. As research continues to advance, it is essential to focus on both pharmacological and non-pharmacological interventions that promote the well-being of individuals with PPA. Raising awareness and sharing real-life experiences such as that of Bruce Willis can further help destigmatize the condition and foster a supportive community for those affected.